I am Dr. Sumathi Jones. Come, let's explore about hypertension today. Hypertension is one of the most prevalent and significant global health challenges. Coming to global prevalence of hypertension, the WHO estimates that over 1.28 billion adults aged between 30 to 79 years have hypertension. Approximately 46% of hypertensive adults are unaware of their condition. Only 42% of individuals with hypertension are diagnosed and treated. Fewer than 1 in 5 hypertensive individuals have their blood pressure under control. Coming to hypertension in specific populations, age factor. Hypertension is more prevalent in older adults with rates significantly increasing after the age of 50. Gender differences. Men tend to have higher rates of hypertension than women before the age of 50, but post-menopausal women have higher prevalence than men at the same age. Coming to the population, urbanization is associated with higher hypertension prevalence due to lifestyle factors such as increased salt intake, processed foods and reduced physical activity. Obesity and metabolic syndrome has a correlation. Hypertension is a major risk factor for cardiovascular diseases such as heart attacks and strokes, which account for more than 10 million deaths per year worldwide. Uncontrolled hypertension increases the risk of chronic kidney diseases, heart failure and dementia. Coming to the signs and symptoms of hypertension, hypertension is often called as a silent killer because it may not cause noticeable symptoms until it reaches severe or life-threatening levels. First, it is asymptomatic in earlier stages. Most people with mild to moderate hypertension do not experience symptoms, which is why regular blood pressure monitoring is crucial. Symptoms in severe or uncontrolled hypertension. When blood pressure is significantly elevated, more than 180/120 mmHg, symptoms include headaches, dizziness or lightheadedness, blurred vision, chest pain, shortness of breath, nosebleeds, fatigue or confusion, ringing in ears and swelling in the legs. Hypertensive emergency signs include severe headache plus confusion or difficulty in speaking, possibly stroke, chest pain plus shortness of breath, possibly heart attack, and severe anxiety plus rapid pulse, which is hypertensive crisis. Coming to the management of hypertension, managing hypertension involves lifestyle modifications, pharmacological treatments and regular monitoring to reduce the risk of cardiovascular diseases, stroke and kidney failure. So, how can we manage hypertension effectively? First, we start with lifestyle modification, which includes non-pharmacological approaches. DASH diet, that is dietary approaches to stop hypertension, that is intake of fruits rich in vitamins and minerals, vegetables, whole grains and lean proteins. The diets which include low in saturated fats, red meat and added sugars, and intake of high potassium, calcium and magnesium diets. Next, most importantly, limit alcohol consumption. Coming to next factor which can reduce hypertension will be physical activity. Engage at least 150 minutes of moderate intensity exercise per week, that is brisk walking or cycling. Muscle strengthening activities twice per week, weight management and stress reduction will also reduce the blood pressure. Coming to causes of hypertension, we do classify hypertension into primary hypertension and secondary hypertension. In primary hypertension, the cause is unknown. It may be due to genetics, age, obesity, high salt intake, sedentary lifestyle, alcohol consumption, smoking, stress, poor diet or sleep deprivation. Causes of secondary hypertension, wherein we know the cause, it may be due to kidney disorders, endocrine disorders, vascular causes, neurological or sleep disorders, medication induced hypertension. Coming to pharmacological treatment of hypertension, for patients with persistent hypertension, that is BP above 140/90 mmHg or high cardiovascular risk, medications are recommended. The choice of drug depends upon the patient's age, comorbidities and severity of the hypertension. Etiology of the hypertension includes mainly the hypertension may be due to vasoconstriction, changes in renin-angiotensin-aldosterone system, alteration in sympathetic activity, retention of sodium and water. So, the drug treatment will be based on the causes. To start with, vasodilators. So, we have direct vasodilators which can dilate artery, vein or both artery and vein. So, arterial dilators includes hydralazine and venodilators includes nitrazine. Both arterial and venodilator include sodium nitroprusside. The mechanism behind the action will be these vasodilators will relax the smooth muscles, decrease the vascular resistance and will lower the BP. The most commonly used drugs are hydralazine and minoxidil. Next, the reason may be due to stimulation of renin-angiotensin system. So, as soon as our BP gets reduced, renin from the juxtaglomerular cells of kidney gets stimulated. It activates the conversion of angiotensin 1 into angiotensin 2 through the action of the enzyme angiotensin converting enzyme. So, the angiotensin 2 is a potent vasoconstrictor. It will cause vasoconstriction and increase BP. Simultaneously, it will stimulate the aldosterone to stimulate the retention of sodium and water, which in turn will lead to edema and increase in BP. So, coming to the drugs, we have two classification of drug which can modify the renin-angiotensin system. ACE inhibitors, that is angiotensin converting enzyme inhibitors, prevents the conversion of angiotensin 1 to 2, and angiotensin receptor blockers. These drugs prevents the binding of angiotensin with the receptor. In both the cases, vasoconstriction is prevented and retention of sodium water is reduced. So, coming to the mechanism of action in detail. So, as soon as ACE inhibitors are administered, it prevents the conversion of angiotensin 1 to 2, thereby angiotensin 2 level is reduced, vasodilatation occurs and causes reduction in BP. Simultaneously, there is reduced aldosterone secretion and decreased blood volume. Coming to ARB blockers, they prevent the binding of angiotensin 2 with the receptor. Thereby, vasoconstriction is reduced and vasodilatation occurs. Next, we all know that calcium is involved in muscle contraction. So, cardiac muscle contraction will increase the force of contraction and heart rate and overall cardiac workload. When it increases, systolic BP will increase. So, calcium channel blockers are given which will prevent the action of calcium and reduce the cardiac activity. Commonest example for calcium channel blockers are diltiazem, verapamil and nifedipine. The third reason may be due to stimulation of sympathetic activity. The drugs blocks the binding of adrenaline with the alpha receptor or beta receptors. So, when the drugs prevents the binding of adrenaline with the beta receptors, we name it as beta blockers. The commonest examples are propranolol, metoprolol. Coming to alpha blockers are the drugs which will prevent binding of adrenaline with alpha receptor. In both the cases, vasoconstriction is reduced and promotes vasodilatation, which in turn will reduce the BP. Coming to centrally acting drugs, alpha methyl dopa and clonidine, these two drugs will block the synthesis of adrenaline at the central nervous system. It prevents the synthesis and release of adrenaline. So, there is decreased sympathetic outflow, which in turn will reduce the heart rate and will promote vasodilatation. Overall, it contributes to the lowering of blood pressure. So, coming to the drugs, each and every drug has a side effect. Alpha blockers mainly will cause dizziness, fatigueness and headache. Beta blockers will cause fatigueness, cold hand and feet and depression. ACE inhibitors will cause persistent dry cough, elevated blood potassium and lowering of blood pressure. Calcium channel blockers will cause swelling, flushing and constipation. ARBs will cause dizziness, elevated potassium and fatigueness. So coming to diuretics, what are diuretics? We call it as water pills. What will these drugs do? They will prevent sodium and water retention. They will facilitate the excretion of sodium and water and thereby reduce the blood pressure. Diuretics are classified into high ceiling diuretics, medium efficacy diuretics and potassium sparing diuretics. The commonest adverse effect of diuretics are dehydration, as they facilitate increased urination and they will also cause electrolyte imbalances. Coming to first line antihypertensive medications, ACE inhibitors are preferred. ACE inhibitors are mostly pril family. Examples are lisinopril, enalapril, ramipril and so on. They are mainly preferred in diabetes, chronic kidney disease and heart failure patients. The commonest adverse effect when given are dry cough, hyperkalemia and angioedema. Second drugs under the first line category will be calcium channel blockers. It includes amlodipine, nifedipine, diltiazem and so on. Calcium channel blockers are mainly preferred in older adults, African Americans. Side effects of calcium channel blockers are mainly swelling and dizziness. Coming to ARBs, which is the third category of the drug, under first line examples are losartan, valsartan and telmisartan. Mainly ARBs are preferred in ACE inhibitor intolerant patients, and then fourth category will be thiazide diuretics. Examples are hydrochlorothiazides, chlorthalidone and so on. Mainly thiazides are preferred in elderly patients and African Americans. The side effects are electrolyte imbalances and dehydration. So the first line drugs include ACE inhibitors, calcium channel blockers, ARBs and thiazide diuretics. Second line medications are beta blockers, direct vasodilators and aldosterone antagonists. Beta blockers includes metoprolol, propranolol, carvedilol, and we do classify beta blockers into non-selective and cardioselective beta blockers. So non-selective example will be propranolol and cardioselective the example will be atenolol, metoprolol, bisoprolol and so on. Beta blockers are mainly preferred in heart failure and cardiac arrhythmia patients. Direct vasodilators are mainly used in emergency or hypertensive crisis condition. Aldosterone antagonists are preferred in resistant hypertension treatment. So we do have special consideration in hypertension management. So in resistant hypertension, the patients are advised to strictly adhere to lifestyle changes and spironolactone, an aldosterone antagonist is prescribed. And the secondary cause is considered. Coming to hypertension in diabetes, preferred drugs are ACE inhibitors and ARBs. Hypertension in chronic kidney disease patient, again ACE inhibitors and ARBs. In hypertensive patients during pregnancy, labetalol, methyl-dopa and nifedipine are preferred drugs. The drugs avoided during pregnancy are ACE inhibitors, ARBs and diuretics. So in case of emergency during pregnancy, hypertensive emergencies in pregnancy, examples like preeclampsia or HELP syndrome, wherein hemolysis, elevated liver enzymes and lowering of platelets occur. In hypertensive emergencies during pregnancy, labetalol is given IV, hydralazine again as an IV and oral nifedipine is prescribed. Other than that, magnesium sulfate is used as a seizure prophylactic treatment. So coming to antihypertensive drugs, the causes of hypertension is mainly vasoconstriction, stimulation of sympathetic nervous system, stimulation of renin-angiotensin system, retention of sodium and water, activation of calcium. So the drugs used will be vasodilators, central sympatholytics, beta blockers, alpha blockers and then calcium channel blockers and diuretics. So what will be the take home message? So we all know that hypertension can lead to stroke, kidney disease, and it may also be fatal. The common causes of hypertension is vasoconstriction, stimulation of sympathetic activity, stimulation of renin-angiotensin system, retention of sodium and water, activation of calcium channels. So what should be done? The drugs like vasodilators, which can dilate artery, vein, or both artery and vein, are prescribed. The drugs which can act on sympathetic nervous system like central sympatholytics, alpha blockers, beta blockers can be prescribed. So the stimulation of sympathetic nervous system is followed by stimulation of renin-angiotensin system. So the drugs which will interfere like ACE inhibitors and ARBs are preferred. Retention of sodium and water may lead to increased BP. So diuretics like high ceiling diuretics, medium efficacy diuretics and thiazide diuretics are preferred. Activation of calcium channel is blocked by giving calcium channel blockers like verapamil, diltiazem, nifedipine, felodipine and so on. So with these drugs, the BP can be monitored, but regular monitoring of BP, maintenance of proper diet, exercise can lead to healthy lifestyle. Thank you.